Well, happy Tuesday to everybody. We are so excited that you have taken time to meet us in the break room. This is Pastor Jennifer, lead pastor here at Jackson Revival Center, and I have with me Sister Ruby Denson, who is a family nurse practitioner, and she happens to be over our health and wellness ministry, and so we are so excited. Sister Ruby, tell us how long you have been in nursing and a family nurse practitioner.
Well, I have been in nursing for 33 years. I have practiced as a nurse practitioner for 26 of those 33 years.
Yes. Well, I can speak from personal experience that you are a blessing to the body. You have hosted so many different events here at the church. We have made a consistent effort to keep people on top of their blood pressure, taking care of hypoglycemia, hyperglycemia. We've done blood drives, we've done health screenings, you name it, we've done it, and you do a phenomenal job. And so I've been waiting and excited to get you into the break room. And as you know, we are dealing with this global pandemic, dealing with COVID-19. We've really been seeing it here in the United States since, I believe, February in great number, and unfortunately it has just continued to spike and spread, and the numbers have continued to increase. I've heard recently that the number of deaths are decreasing, which is encouraging, which means we're learning some things as we go as far as treating it. But let's talk a little bit about specifically Mississippi, as we're dealing with it, and some of the health disparities that we deal with that maybe cause us to respond to COVID a little bit differently. But kind of just, let's talk about Mississippi and health.
Well, Mississippi, we're in the southern region of the country, and as we know, we can kind of like think about Mississippi in the south and the southern states like Alabama, Louisiana. We're called FACT states. We are at risk for having more health issues because of how we eat, our viewpoint on exercise, and just how we care for our bodies. And first and foremost, we are at a disparity because of those reasons. Because in Mississippi, we have a higher rate of diabetes, hypertension, heart disease. We see more strokes and heart attack. So because of all of those disparities that we have with not eating right, not exercising, and just not caring for our bodies. And not only from that perspective, we are one of the poor states, and with that being an issue, then people are going to first, take care of their basic needs before they think about, well, I'm going to pay for this money for my medication, or I'm going to think about this aspect of my health. They will, do the survival needs first, and then the health care needs and all of those things come afterwards.
Right.
So that's why we're in the state that we're in.
Right. I know Mississippi is known as the hospitality state, and so unfortunately sometimes we are known for taking care of others, but we don't do such a great job at taking care of ourselves, and so it's coming back to haunt us in some of these things. I've really been encouraging people to wear their mask. I don't particularly enjoy wearing one myself, but I do because number one thing I know is that you can have it and not know it. That there are literally people who can test positive for coronavirus and have no symptoms whatsoever. So one thing I've really been trying to do is encouraging people to wear their mask. Let's talk about that, because there's a great debate. There are people out there who say this is all just a hoax, that this is driving numbers for political season. We know this is an election year, but you are in the hospital setting. You have worked with patients who have not lived, who literally have been taken out by this virus. So talk to us a little bit about what is reality as it relates to COVID-19.
Well, reality is this is a virus, and it is here. It is not going away. A lot of people have mentioned things like, oh, the sun and the summer is going to come, and then it'll get away. We'll get rid of the virus from the summer heat. That is not the case with this particular virus.
Right.
It is so very important for us to curtail this virus by doing, just essentially 3 basic things: covering your face, and social distancing, washing your hands, and remaining healthy, because we can save so many lives if we were just to do those things.
Right.
And there, like you mentioned, a lot of people think that it's just a myth, and you don't have to. But in the hospital settings, if you were in the hospital setting and you would see the acuity level of the patients that we're caring for, and what they are actually going through on a day-to-day basis, you will say, wow, I could just do that. Let me just do that for this period of time so that others can stay well. A lot of times in the just general population, most people don't have that interaction in a hospital setting, but we as healthcare professionals, we see it every day, and it is it's heartbreaking when you see someone come in healthy, walking and talking, and then some of them don't even make it through that hospitalization because of COVID-19. So once again, I stress again, wear your mask, avoid large crowds if you can, do the social distancing, and then do good hand washing. Those techniques are just simple, and it's essential for us to get through this. We will get through it.
Absolutely.
But it's how we get through it.
I know one of the things that has been concerning for me, as a pastor right now, we've been trying several times to begin coming back to in-person worship, but it seems like every time we kind of determine a target date, we're seeing a peak and a spike in these numbers, and so it has made me draw back from coming to in-person worship when I know I can keep my members safe doing things online. But online for me is not a forever response to this. And so for me, we've got to learn how to be responsible. And I was in a setting that could not be avoided recently, but we let people know, please, do not congregate. Please do not. It was a funeral setting. We asked people, please, we know everybody wants to love on this family, but we want to keep everyone safe. And right behind the funeral, I see a niece go up and kiss this uncle on the lips. You're my uncle. I should have the right to love on you. And I'm going, and that's our problem right there, because we literally can love people to death.
Right. That
we can love people so much, we're not willing to do what's best for them and what's right for them. And my heart breaks because obviously I'm a people person. Yes. I love to hug people. I love to see people. It's difficult for me as a pastor to be separated from the congregation. I miss loving on people and hugging on people, but for me, I love them so much that I don't want to unnecessarily put them at risk. And I think that that's one of the things some people are missing, is that our love should cause us to sacrifice for the good of others. And that's kind of, for me, where wearing the mask comes in, because number one, we could have it, not know it. But number two, physically, I'm pretty healthy. I could make it through. But if I could have it and not know it, I could carry it to somebody who has pre-existing conditions, who may already have things going on they may or may not know about, and I could literally put them at risk. That's a scary thought to me.
Absolutely, Pastor. I just have to say that, or piggyback on that, I know personally of a family that I don't know how the virus was originally contracted or conveyed, but 3 family members are now hospitalized, or are both not hospitalized, but maybe just carriers. They have one that's a younger one that's older, that has some underlying health conditions, and then one that's a little bit younger than that oldest one. But this virus, it does not have a name tag or say, you can get it or you can't get it. Anybody can get it. Doesn't matter about your color, your, how, if you're short, tall, big or small, it doesn't matter. So, if you're in the situation or where you have elderly family members or loved ones or people that have underlying health conditions, I just encourage everyone, if you have those type situations, try to stay away, or if you're going to be all out and about, try to protect your family members and your loved ones, because you don't need to bring that back to them, because they are a vulnerable population. And for one example, in our our nursing homes, you can see it all over the country, the deaths and the rise in the death rates of all of the people in the nursing homes. Most nursing home patients or residents, they can't get out and go. So the community is bringing it into them, and they're putting them at risk in their lives. They're losing their lives, and not only their lives, even some of the employees are contracting the virus, and then they're losing their lives. So it is so apparent and obvious, if we can do those simple things, wear your mask, just social distance, and just self-quarantine if you know for sure you're positive, because we even have people that are out here that know they are known positive, got their test results, and they say, I can't stay in the house these 14 days, I'm going to go out, I got to go to the store. That is irresponsible. We need to get on top of this and be more responsible. That's the bottom line. You can self-quarantine for 14 days, and you can be responsible to save a life for some others.
Absolutely. I know someone who went and got tested. They tested negative, but they had all the symptoms. And so they said because of how bad they felt, they were utilizing, delivery services. So they stayed home, quarantined themselves, even though their test came back negative. They said, I don't feel right. I have all these symptoms, so I feel better staying at home. And so they were telling me how they utilized, the different grocery delivery services and those kinds of things where they, paid for everything electronically and had their groceries delivered. And I was so proud of them for being so responsible, and for thinking of other people. I've seen people out and about waiting for test results, and I'm going, well, if you're waiting for results, you need to be at home, because if you were positive when you tested, just because you don't have that result yet, you're carrying that whole time. It don't start when you get your results.
Absolutely.
It has already started when you get tested. And then I've seen people say, well, I was tested 3 months ago and I was negative, but the test isn't good for a lifetime.
Absolutely.
Okay.
It's called, the test is only a point in time test. So you can get tested today and get your results back, tomorrow or the next day or the same day, and you can be negative. But you can walk out and you can come in contact with someone that is, positive for the virus, and then that starts a whole nother cycle again. So if we're doing the COVID testing, now the antibody testing is a little bit different, but if you're going out and just getting the COVID testing where they're doing the swab, it's just one point in time. So you definitely need to understand that process. Just because you tested negative today does not mean a week from now that you cannot, come in contact with someone else and then test positive again. So or even have symptoms. And you were speaking about a person that actually had all of the symptoms. These tests are not 100%. You could have a false negative, and so we need you to understand that if you are having all of those symptoms, you should treat it just as that. Quarantine at home. Speak with your healthcare provider. They can give you excuses from your healthcare providers to give to your work, your jobs, and so that they can understand. I want you to be. I work in a healthcare setting where I'm responsible for the the hospital staff, and I don't want you to come to work because you risk putting my workers, the other your other hospital co-workers at risk, the patients that we serve at risk, and then not only that, yourself and your family. So, to protect everyone, shelter in, self-quarantine, care for your body, do the self-help things that you need to do while you're at home and get better before you come back out or entered, into the community. Because like I said, this is a virus, and it's community spread now. We are seeing more community spread, widespread from this in particular virus.
Right. I know a lot of people too think if they gather outside that it can't be spread. Right. But going to a barbecue, cooking out, those kinds of things, you can still spread it. People are touching the same utensils. People are passing things, sharing things, but even being in close proximity. Absolutely. So I think that's another thing people need to understand. I've also heard people say, well, I've already had it, so I can't get it again. And so we know that that's not the case either. You can get it numerous times. Right. Am I correct?
Absolutely. And I've treated such cases,
Okay.
A person is tested, positive at one point in time, and then retested and was positive again, had the symptoms all over again because there was another exposure. So, and sometimes the symptoms may even lag on further along than the 14 days. So, you could be what we call a super spreader. You can be one person that has, the virus really, really bad, and you can just spread it and just contaminate everybody. And, those situations, we want to try to prevent those if we can.
Yeah. I know one of the things for me, I'm really encouraging people just to stay healthy all the way around. If you don't have to go to the hospital, you don't want to.
Right.
But, some of the most heartbreaking things as a pastor that I've seen are people who had to bury parents that they've not been able to see for weeks because they were in the hospital ill. Some of them went into the hospital and did not have COVID when they went, but they contracted it while there. And, daughters and sons not able to see them for weeks on end, and these individuals basically died alone without their family there to hold their hand. And that has been so hurtful and so painful for some of the families that I know. And I believe that that's something people really need to keep in mind. I'm a faith preacher. I believe in the Word of God, but I also believe in exercising common sense.
Absolutely.
And I don't believe that, getting coronavirus is a death sentence, but for some people it is.
Absolutely.
And so I don't think we should take it lightly, because there are people that are having to die alone, and they're not all elderly people. I know early on it was kind of disproportionately affecting the elderly, but here recently we've been seeing that the greatest surge and the greatest spike is in those 18 to 40 years of age. I think more specifically 18 to 35. And they are kind of equating that to these socialization, large gatherings. Where young people are kind of just feeling like, well, I'm young, I'm strong, I'll deal with it. The issue is grandmother may not be able to, or, even sometimes we've got toddlers and children with asthma, with respiratory issues, and they're not always able to beat it either.
Absolutely. And just as you mentioned, I work in a hospital setting, and, life since COVID has changed.
Right.
Everyone can't come into the hospital now.
Right.
And that by itself, when you're in a hospital, you need to be there with your loved ones.
Absolutely.
Most of the
time.
Look,
they would think Superman was bad, because I would be, I guess it's Spider-Man. I would be scaling the wall of the hospital to get to my mother, or to get to my grandmother, to be with. I could not imagine being separated from them, especially knowing they were deteriorating in their condition, and I couldn't be there. It would be traumatizing just to know that was happening, but then not to be able to be there.
Absolutely.
That's a lot.
Yeah, well, in some cases too, it is a lot, and like I said, this is why the healthcare professionals, we feel the brunt or the impact of it. So because we are their extended family of the patient that are hospitalized now, but they have certain things and mechanisms in place. They have the iPads. I know in a lot of the nursing homes, where people have just shut the doors where no one can come in.
Right.
and they have iPads and they can do the FaceTime so that the loved ones and family members can, video call in to see their family members. And some cases that can happen also in the hospital setting. But what about your family member that's in ICU that that they don't, they're not responding, or they are, in a coma. Sometimes just having somebody at your bedside and you just talking to them and holding your hand, and they know, I believe, by me being in nursing all of these years, that has been one of the things that have drawn more people back to this side of life and living. When they have a loved one or someone that came in on a consistent basis and talked with them and loved them and just say, okay, you can beat this and come on through it. Right. So that's one of the things that is so disheartening for us as healthcare providers, and seeing that on a routine basis when family members can't come in. It's hard for us, as employees, where we can't, allow family members to come in. So it's a challenge.
Yeah, I know we've got an elderly member of our church who actually just turned 100.
Wow.
And it was disappointing to not be able to celebrate her 100th birthday, and so it's those kinds of things. But then the concern for me is also beginning to hear reports of those who have been in the nursing home, isolated from their family members, who are now starting to suffer from failure to thrive, that they don't have enough of that familial contact, and so that's disheartening as well. And so these are things, not to scare people, but for us to really be thinking about when we're talking about our rights and, I shouldn't have to wear a mask and those kinds of things. Well, you have a right not to wear one, but when you do, you're putting yourself and people in a dangerous position. And so I think it's not a matter of our rights, but it's a matter of our responsibilities.
Right. And I want to say this other thing too, your right to not wear a mask, you don't know how many other people that it impacts.
That's right.
Because you went and got tested, and then you decided to come out, after you got tested, and then once you get your results, you were positive, just like you were saying at that point in time. All of the people that you have come in contact with till you got your results, those people are impacted. Some people, have family members that they have to care for, so they have to stop working, they have to stop going to see their loved ones or caring for their loved ones. It's about a responsibility, from all of us. If I have to be out of work for 4 days, get tested and wait for my results, and some people depend on their paycheck. They don't get paid if they don't go to work.
That's right.
Or some people are the only care providers for their loved ones. So if they don't, be available to take their loved ones to the doctor, then that loved one don't have that ability to get to places that they need to do. So we need to look at the whole picture and not be so self-serving or self-centered, and think about everybody else, outside of what we are going through. We need to be thinking about the whole picture and how it impacts everyone. And if we can get to that point, we can get through this, and we will get through it if we can get everybody on that same page with us.
So let me ask you this. I know that Dr. Dobbs is from the daily briefings and things like that. He's really based on what the numbers are now, and based on the spike. We know more people are being tested, so obviously the numbers are going to increase because we're getting a truer idea of how many people have this virus. But he's predicting a difficult fall. And so what would you say are the factors that contribute to that, outside of just people refusing to change their behavior?
Well, going into the fall, the fall season is flu season. Flu is another viral phenomenon. So a lot of the symptoms that we have for COVID are going to mimic flu. So it is going to be so challenging with flu going on as well as COVID. What I look at and I see, because I deal with flu season. Also, you may see me on television, saying I'm giving out flu shots because of how important that is. But what I see that we'll have two different phenomena going on. We could easily wipe out a workforce. If you get COVID-19 and then you have the flu, we won't even have people in the hospital to care for our patients. And that was one of the fears early on. When we had limited testing, limited PPEs. We also had a fear that we could wipe out the healthcare force to care for these people or the patients. If they didn't, if they contracted the virus. So that's what we're looking at going into the fall season of the year, because these symptoms of COVID mimic flu, and they will have both of those things going on. And we can easily test for flu, true enough, but we'll have to be more in tune to what's going on with COVID so that we can be on top of it. And it's going to be a challenge for us doing that, during this fall season, trying to, identify which one it is.
Yeah, I guess the concern for me too is thinking about the children possibly returning to school in the fall. So you're already looking at people kind of being together in greater number, which we know is going to increase the spread. But then having flu season coming along with that, then COVID with that, it's a little unnerving, and something we know we're going to have to pay attention to. And for me, I think not just about the church, but we have a preschool, we have an after school, those kinds of things. So, there's so many things to consider, so much pressure with all of these decisions, because every decision we make, they're affecting the people we do see, but they're really affecting everybody we don't see.
Absolutely. Connected,
and so there's so many things to take into consideration. Yet, I understand our economy can't be shut down forever, because it's not built to take care of everybody long term. And so, I understand the concerns with that. So there's a lot of pressure.
Right. Well, as I mentioned, we're going into flu season, and it's always been a challenge in the past to get people to get flu shots.
Right.
If we can get more people early on to go ahead and get their flu shots, that can help out, because we have a vaccine for the flu, but we don't have a vaccine for the coronavirus.
Right.
So if we can get you vaccinated early on for the flu, then maybe we can press those numbers down, because it has been proven that if you get the vaccine, that it can decrease those numbers. That I know a lot of people have different beliefs about flu shots, and that's one of the things probably why they have their beliefs about the coronavirus. But if we can get that kicked off early on in the season, flu season, which is going to be starting the 1st of September, the end of October, you'll probably be seeing them in your pharmacies. That will greatly help us going through the fall of the year, addressing the coronavirus, just like you said, going back to schools, the football games, and the activities that our children will be involved in. Most college campuses, you have classes that are 100 and 200 members strong, where you have classes that you can't. How can you not? How can you social distancing in classes like that? So we got a lot of challenges before us, and we're gonna have to be thinking on that even right now, of how we're gonna manage that, even with our public school settings. It impacts everybody, because if you bring it home from if your mother or father has it, you give it to your child, and you bring it to school, you can wipe out a whole classroom, a whole school with the virus. And I've seen this happen. I've seen that it spread so rapidly that where we've had to shut down a unit, or or dismantle a workforce. And those are the things that my concern is for our children, the workforce. Then everybody else that it impacts, when we contract the virus.
Right, because we know that the hospitals can somewhat get overwhelmed during flu season. And so the concern that Dr. Dobbs was sharing on one of the daily briefings was that, if it gets overwhelmed with COVID alone, you could possibly have people having car accidents or strokes or heart attacks, things of that nature, and there's nowhere to put them, And so for me, if you don't have to be out, it's wise not to be, not to put yourself in danger unnecessarily. Two more quick questions. One is, so we see different strains of the flu, like influenza A, influenza B. So are we starting to see different strains of COVID-19? Is there such a thing, or is the virus beginning to mutate, or is it too early for us to know that? Or
well, I don't have that information that I can share at this point in time, so I'm really not sure. But I do know that we have several strains of the flu, and the CDC is working on that, and I'm sure they're going to be working on COVID as well, and then they'll give us the information, and as that information comes out, it'll be disseminated as such. But I don't have the facts before me, so I can't speak on that.
Gotcha. Mm-hmm. Well, one thing we know is still very early on for us to be dealing with this, and I know when it comes to a vaccine, I've already heard a lot of people say they would be leery of taking it. There's a lot of there are lots of ideas, lots of theories, lots of things going on with that. But I guess for me personally, one concern that I would have, and I'm going to always play both sides, is that we know typically for a vaccine, there's a lot of time testing those vaccines to see how people would respond. So if I had a concern, one of my concerns would be, have we had adequate time to test it to know if one is available, that it's safe for people to take?
Right. Well, as you know now, we've got some human trials going on now.
Mm-hmm,
they are, testing, with vaccines right now, and we won't know until we get it out. And so it's early on, and I know we're probably not going to get anything before the beginning of next year or next season, in the fall of the season. But it just depends on how these trials come out and what they what the studies show. So we'll just have to just continue to monitor that and watch and see what actually happens. So I'm anxiously awaiting the vaccine because of what all I see now. We need a vaccine, but in the past it has taken years to get it right, and even now, just like for example with the flu vaccines, although they do different trials every year, we don't get it right every flu season. Right. That's obvious, because some years our flu seasons, more people are impacted by it because we just didn't hit the right strand, and so it may end up that way with COVID. If it is a different strand, I'm not sure. But as I said, the experts at the CDC and the ones that are doing all these trials, they'll be able to give us and provide us more information, and we'll just have to play it by ear.
So what are some things people can do to build up their immune system specifically?
Well, I can't just say this is for everybody. I'm gonna tell you, you have to really, consult with your primary care provider. But some of the things that my family members, in my household, I can speak on that. I can speak about my household. We have been using elderberry. We have been using zinc, and then just some multivitamins. Like different gummy bears, multivitamins to help, making sure you stay hydrated, and get plenty of vitamin C. So those are some of the things, but you need to really, just confer with your healthcare provider, because everybody is different because of the health status, their status. Some people may be taking different medicines that they may not be able to take all of these supplements and all of those things as well. But from my standpoint, those are some of the things that we do.
And let me ask you this: everybody becomes a professional when they get on social media,
right?
And so I've heard different things flying around. But one of the things we talked about early on was that COVID-19 was kind of disproportionately affecting people of color, and one of the theories I had heard behind that, in addition to just pre-existing and underlying conditions, was a lack of vitamin D. Do you know if there are any studies out there specific to COVID that would support that? What would you say?
Not specific to COVID, but there are a lot of studies out there about vitamin D deficiency, and I'm African American. I can speak on it, and I have a vitamin D. I didn't even know I had a vitamin D deficiency until they just happened to test me. And a lot of African Americans, that's something that you need to, just have your primary care provider to check those levels for you. And I take a 50,000 international unit capsule, a caplet, like once a week, and those things can, you can get your supplement, vitamin D supplements from there, and then good sunlight, being out in the sun as well. And of course, your milk and your cheese and things like that have vitamin D in it. But if you are deficient, you're gonna need that supplement. So always talk with your primary care provider. They can do a lab test. It's easy. You can just get it done with your routine or your annual lab work. And like I say, most people, especially African American people, they don't know it, because I didn't know it. Mine was almost like 3, and it's supposed to be way above, that number.
I know my mother takes vitamin D. She has to take a supplement. And I know sometimes as we age, we have to incorporate certain things. I just turned 47, and I'm taking B12 every day.
Well, you better check your vitamin D.
Right. Absolutely. But those vitamins you mentioned, I'm taking a multivitamin every day, taking vitamin C, taking elderberry, and so I do not want to get it. I'm trying to do my best, but sometimes as a pastor, there's certain environments you can't avoid, and so for me, I'm trying to eat well. I'm trying to rest. I'm trying to take vitamins. Wear my mask, wash my hands, socially distance, not be in large crowds. I'm doing the stuff I know to do, but I'm trying to get the folks around me to do it too.
Absolutely. If we could do that, we would be batting 100.
Yes, ma'am.
Yes, ma'am. Right here, like I said, I'm covered.
That's right. Absolutely. And I believe in exercising all of the common sense. I know that knowledge is key in dealing with a lot of this, and then beyond that, it's my faith. The Bible says in Hebrews chapter 11, without faith it is impossible to please him. They that come to him must believe that he is, and he is a rewarder of those that diligently seek him. So I'm putting my hope and my trust in him, but I'm doing the stuff that I know to do. I'm going to do my part, and then I'm leaving the rest up to him.
Amen.
So, but look, I thank you so much for taking the time to come and be with us today. We're trying to get the information out, share as much as we have, share as much as we know with the body of Christ and with whoever is watching. And, we just want to do our part in being socially responsible and taking care of our community. So thank you for sharing of your time, your knowledge, and we pray that you guys got something out of this on today. And if you did, give us some feedback. Let us know if you got some questions. And I want to let you know we are kind of in an effort ongoing to make sure everybody has a mask, to make sure everybody has hand sanitizer. So if you don't have one, reach out and we will make some available. We've already had a couple of mask drives where we were able to give masks away, and we have some more that we are planning to do. So if you reach out and let us know you need one, we're going to make sure you get one. All right. Love you guys. Have a great rest of the day. Thank you for taking time to meet me in the break room, and we're looking to see you next week at this same time, same station. Until then, may God's absolute best be yours in every area of your life. Love y'all. Have a good one. Bye-bye.